if I ever die and somebody looks at my Google searches, I don't know what you would be able to tell about me because I Google some of the wildest things. But I did look, do ducks have rabies?
This is On Call.
Wow, this would be really cool to just wear scrubs all the time. Then you don't have to think about what you're going to wear to work.
Joke is awesome. We're here to answer your questions. We can sit down and discuss them. Wait, I gotta go. I'm on call.
Wait, you're on call? I thought I was on call. Hey, everybody. Welcome back to another episode of On Call with April and Alicia. I'm Alicia.
I'm April.
And we're happy to be back.
We are.
April.
Yes.
Still cicadas. There's still cicadas. Yep.
Ugh.
Yep. I feel like every day I look up if there's still going to be cicadas. Just in case maybe Google or whatever AI is telling me that they're supposed to be gone mid-June has changed their mind and maybe it'll be a week earlier. But I do feel like it's starting to get a little bit later. They're bad. So this is the only time of the year. Yeah, I would favor colder weather right now if it got rid of them.
That's a lot for you to say that because you hate the cold.
I hate the cold and I love rain if it's like storming. I don't love rain like when it just rains all day and then you can't get out and, you know, your kids are stuck inside and all that kind of stuff. But the rain, they go away. But then that sun comes out and it gets humid and they're in full force. I was talking to you yesterday. How many times did I get hit in the face?
I know.
I'm like, one's on my shirt.
You were having like a rough 10
face.
minutes outside with your cicadas yesterday.
Yes. Well, I got to follow up.
All right.
To the pets in my yard. But I want to ask you first, how are you and how's the fam? What's new before I get into this shenanigans?
Oh, geez. I'm good. Things are good. We're enjoying summer break, looking forward to vacation.
Kids are finally out of school. I mean,
they're finally out of
they
school.
They were still in.
Yep. They're all done.
What are you guys doing? So?
We're going to Florida for a short trip, but then our big trip is we're going to Japan and Hawaii.
Wow.
So we'll be gone for like 3 weeks and we're super excited. So
I just looked at Japan on a globe the other day. Should I say this out loud?
I don't know. I don't know what you're going to say.
I don't know why I thought it was embedded. Gosh, geography failed me. I think we only looked at the United States where I went to school, but yeah, it's like an island.
Yeah,
I didn't get that.
It's funny you say that because I think that one of the girls said that, like when we first were like, we're gonna go to Japan, and one of us says something about it being an island, and the other one goes, "It's an island." I was like, "Oh, good Lord, yes."
Yeah, but don't good Lord, or maybe she's getting the same base education I got. I just assumed somewhere in Asia is China and Japan.
Okay.
So I mean that was just the way my brain worked. Also, I think we all do this, but while we're talking about geography, we how often we like refer to Africa as a country, and it's not. It's a continent, but
that's correct.
We'll be like they're from Africa.
We've had that discussion.
You know what I mean?
Well.
Yeah, I think it's just. But I just saw Japan. Maybe I was looking at VPNs. I don't know what it was. I saw Japan. And I was like, holy smokes! Hold on, wait. Japan's off to the right like that in the middle. It's an island. It's kind of embarrassing, but whatever. Embarrassing for the world now because there's no going back on saying it.
I know. Your secret is out now. So, but yeah, we're going. We're excited. Yeah, long flight to get there.
How long? Now, it's easier for you to go from Hawaii to Japan though. That's why Pearl Harbor happened, right? Because they snuck around because Hawaii and Japan aren't far away.
Yeah, the flight from Hawaii to Japan is about, I think, 6 or 7 hours. So but we're going all the way out to Japan first and then going to Hawaii and then back to the East Coast because we figured we would just do the longest flight
circle
first,
the whole world
and then slowly adjust the time back. So to get from Baltimore to Tokyo, we actually go through like Minneapolis. I think it's like 14 hours. So.
But how far is it from you to Hawaii?
From the East Coast to Hawaii, it's about our flight coming home is so broken up that I don't know the total flight time.
It's like 10 because it's like 4 hours to Seattle, and then Seattle to Hawaii.
Seattle's like 6 hours for me.
Oh, yeah, I was just talking, but so 10, but so 14. Yeah, all right. So it's just long,
Yeah, it's
regardless.
long, but it's okay.
Or did you get comfortable seats?
We did.
Oh, good.
We
I
did.
say I can't. Okay, this is first world stuff. I don't want to start sounding bougie. I I don't think I could sit upright for 14 hours. I
No,
can't
I
I
mean
can't sleep
it's
on a plane. I cannot. I just can't not sleep on a plane. It doesn't matter if I have a window seat, doesn't matter if I'm in first class. It doesn't matter. I can't sleep on a plane and I can't sleep in a car. So all I know is like I will get to that delusional point where I'm like I just want to sleep so bad. I just need to recline and lay down. If I can lay down, I think I could sleep.
Yeah, I used to be able to sleep on and I can sleep on a plane, I can sleep in a car, but lately like when I fly, even if it's a shorter flight, like maybe 2-hour flight, I get so restless and I'm like sitting and I'm like stretching my legs and I want to just get up. I don't I don't
Hmm.
know what it is, but lately I've been struggling. So we did get comfortable seats where we can put our feet up a little bit. So
Good.
we should be good. Yeah.
When we sent my mom to Egypt for her 70th, um, that was like it was her combined Christmas and um, birthday gift. I got her a first class flight to Egypt because I was like, well, it wasn't first class. I think it was like business class, whatever. It was the pod, but I think some of those are like business class pods too. They're not necessarily first, but she's got just all these like health issues. And I was like, she doesn't have a joint that's not like manufactured somewhere.
Yeah.
And I was like, that year it's good. And I just worried about like DVT and like that kind of stuff. And I was like, just go lay down and like enjoy your flight. And she was like, I don't know if I could ever like not fly that way for like long flights now. And I was like, yeah, I haven't even done the long flight yet. I'm already planning it. I'm gonna have to be able to lay down.
Yeah.
I need a pod. I don't need it for the luxury. I need it so that I'm not delusional.
Well, yeah, and like I mean, if you get there and you're jet lagged, and if you're exhausted too, it's just not a good start to the trip.
It's
So
just what do you do? 14 hours sitting in the same seat. I don't even like to sit at my desk for an hour. So that's problematic. And I know people get up and walk and the international planes are bigger, but
yeah, there's a lot
um
more movement in them, I think.
no
So
thanks. I just want my own cubby, like where nobody can bother me too. You gotta knock on the door. That's my love language, knock first or call. Call before you call before you come to my pod. Okay, okay. We don't have that much time today, but I do want to follow up on a story I told you last week.
okay.
Do you remember when I told you I was getting ready to go to Chicago? It wasn't last week or last episode? And the cicadas were over the car, and I pull out the hose, and this duck
Yep.
flies at my face. Okay, so that duck is still hanging around in the morning time. Although I've not seen it as much, because the second time I found it, I did spray just in there, like get out. So I'm out doing yard work this weekend. It sounds like I do yard work a lot. I really don't. I do it to get out of the house sometimes because I'll be like, I can't take you to wherever they want to go buy trading cards, whatever the kids want. I'm like, I got all this stuff in the yard to do, and I just go out there and find things to do. But whatever I don't know why. Oh, I was trying to move some mulch around, and I put a ton of mulch on the side of the house. And I know my neighbors are annoyed because it's just a heaping pile of mulch. I've not even spread it out yet. I at least got it there though. And so I start moving it. I was going to move some of the mulch to this front bed, and I put this new plant in, and I get it with the shovel. Egg. It's an egg. But immediately I do like like that kind of a scream, throw the shovel because my first thought was it was a snake. I had just hit a snake's nest or something. Um, and I was like paranoid. I stalked that mound all day. I would just take like sticks and try to move. I wanted to know how many eggs were in it. Then all of a sudden it occurred to me, it's not where the duck flew at my face, but I wonder if that duck is laying eggs in my yard. And
Oh.
I am finding eggs all in my flower beds now. Like those front beds where it first flew out at me. And just yesterday I caught those little rascals, the male and the female, in the yard, hanging out, checking on their kids, and then going over to the neighbor's house. I have it on video. And again this morning, they're back. So they're duck eggs, and that duck that assaulted me is now bringing her children rent free into my yard.
Oh, but you're gonna have little baby ducks.
Yeah.
You need to
Okay.
put a little swimming pool out for them.
No, I don't. There's a pond right across the street.
Oh, I was
So
wondering why they were there. Because you
yeah,
said, I thought
I
you
mean,
said the
we're
other day
kind
they
of
had no water
they.
nearby.
I mean, the pond is you. I mean, you walk 800 feet to the left down the road. But their geese are everywhere down there because all their babies hatched, so they're all over the place. But their babies don't look like babies anymore. They're not cute. They now look like little terrorists. But they the ducks. I don't know if they've got pushed out. I told you we're turning into Animal Planet. If they got pushed out of the pond and into the yard, but I didn't disturb her eggs. Nobody called PETA. I didn't touch anything. I left it all. Of course, I'm gonna let her have her babies. I'll give her a bill later. But um, it's just weird. It's weird that they wouldn't do it by a water source.
That is weird that they did it in your yard.
Yeah, then I was like, do ducks get rabies? I'm telling you, if you look at my Google search, if I ever die and somebody looks at my Google searches, I don't know what you would be able to tell about me because I Google some of the wildest things. But I did look, do ducks have rabies? Because I wanted to know why they're in a flower bed. And then was kind of figuring out, like, why are you just depositing one at a time at different places? That's not necessarily what I think has happened. I never checked that mound fully because I also did read that like if you disturb it too much, then the mom will abandon the nest, and I didn't want that to happen. But what I needed to make sure was that it was not a rat snake nest. And that's what I spent about 8 hours over the weekend one day Googling photos, trying to match the picture of the egg to the photo, like
Oh
trying
my
to take a
gosh.
light to it to see was it leathery? Was it oblong? Could I see? And then, but also then complete had to have my children stand guard. Like if you see a big rat snake come up, like give me a warning because I was so worried that. Or then I read like fox hide eggs. So then I was like, is this fox going to come out of nowhere and just attack me because I'm getting its food source? I was like in a full-blown terror. I shouldn't be terrorized on my own property.
Oh my
I do feel
goodness.
like this is America. It shouldn't happen that way. So
Well, when they hatch, we need pictures of the babies.
I don't know that I'll be that close, April.
You can do it through the window.
Well, no, I can't actually, but from this part where it is, but I do check it. I don't check the egg because I don't want to disturb it. But every morning I see those little rascals. They were, like I said this morning, and I do have the video. I'll send it to you. It's actually kind of funny. Like I'm guessing the brown duck is a mallard. Are mallards brown? I don't know. Do they
Yeah, I
cross
think
maybe?
so.
But mallards are also I guess the male are the pretty green. So it was like the brown duck and the green duck. And so Maddox and I were out throwing a baseball last night, and the mallard, the male, was walking around everyone's front yard, and he was like, "He's such a pimp." And I was like, "What?" And he's like, he's such a pimp. Look at all the ducks just follow him everywhere. I was like, "Oh my
Hilarious.
gosh, we have a
It's
whole
like
narrative."
Donald and Daisy in your yard.
I know, like yeah, that's what I should name him.
Yeah.
I just don't want him to
Donald
stick
and
around. I don't want him to
Daisy.
think I like him. I
You
don't.
do.
No, I really don't, April. Um, they're
I
cute
like
to look
them,
at from a
and I don't
distance.
even
I
know
like them
them.
when they're down at the lake and I'm like, oh, like, wow, look at the ducks. I don't like when they follow you. And I don't love geese at all because we've all been attacked by them. They're pretty aggressive here. So
Oh,
I think they may be pushing them out. That's my theory.
maybe.
Yeah. So anyway, um, more to come on the duck update. Nothing happening in the Atlantic Basin and other news in the Weather Channel. Nothing happening in the Atlantic Basin, but there was a potential hurricane that almost came into Mexico. So there's our Animal Planet and weather news update. What do you have on tap for us today, April, for a topic?
All right. Well, topics for this episode, as I thought about it, I looked and it looks July is actually Herbal Prescription Interaction Awareness Month. So
That's a mouthful.
it is a mouthful, but
What's that mean?
it means that all of those supplements and vitamins that people we take that are over the counter and herbal supplements, they can actually interact with prescription medications. And
Oh,
so this month is all about bringing awareness to that and talking about what those interactions are and just making sure that people are aware. So I thought it would be fun if we talked a little bit about the most common herbal supplements that people use and what they're commonly used for and how they could potentially interact with some medications that we take on a daily basis.
I like that. I also like I like that idea. I do want to do one plug though, April. I want to just say there's nothing wrong with herbal medications
That's correct.
either, you know? So I know that some people have some really strong opinions of, naturopath or whatever. And I don't have that. I think whatever works for you works for you. But I think if we drive nothing else home here, what I'd want to get out of this is that even if it's over the counter, it's still medication. Even if
Yes.
it's herbal, even if it's plant, even if it's from the world, from the earth, from the wherever, the universe, the creator, whatever you call it, it's still med. So yeah, I kind of like that. And I like the approach of here's a safe way to take it. So yeah,
Yeah.
I'm in for that.
Yeah, and to your point, it is still a medication, so there are still potential side effects, there's potential interactions, but also there's a lot of herbal supplements that have not been tested on humans. Like some of them have been tested on animals, things like that. But,
Yeah,
prescription medications are approved by the FDA, right? So there have been tested and
studied.
all those things. And so a lot of these herbal ones haven't. So that's also just something for people to keep in mind as they're
Well,
taking.
I also think if we get in that debate too of like, um, and I've had this with patients too, where well, let me say this a different way. Not just with patients, I think in healthcare in general, you're reconciling a medical, like a med rec, right?
Right.
And a patient comes in, they list, we say, tell us everything you're taking. I do find one of two things. One, the patient doesn't necessarily include herbs or supplements, like vitamins even, in that medication list, because to them, I think the way they perceive that request is what prescription medications am I taking?
Right.
Then also, when you have patients that come in and they do report, hey, I'm taking a B1, I'm taking or all of these, I'm taking St. John Wort, I'm taking blah, blah, blah. That we strike through that. Like either one, we'll just continue it because we're not doing necessarily due diligence to say like, is this potentially interacting with anything and what could it, no harm, no foul? It's an herb or it's a vitamin or it's whatever, or we just like discontinue everything and wait till they discharge home, at least in that acute setting. I'm not saying all people practice this way. I've just seen these as outliers. Um, but I think it's great, just not for patients on this one, right? That we talk about what to look for providers as well.
Yeah. No, that's a good point. It's funny that you say that too, because I had a patient recently and when I ask about medications, I always ask about like over the counter stuff. And this patient I had recently was on quite a few supplements, and to them, it was super important to continue one of them specifically every day in the hospital because they said, I was started on this for a reason by my provider, and I want to, when I go back to my follow up, I want to be able to say that I took it every day.
Oh,
And I was like,
yeah.
okay, I will
And
order
we
it.
have to do good about like communicating that and putting that in records now that we can access all of these external records and things like that. So that we are communicating for our patients and still being advocates in that sense. And if we have patients that are interested in this like method, I do think it's important for us to take the time to understand it a
Yeah.
bit, you know?
Yep. I
Yeah.
agree.
Well, I have one I do want to start out with because this is one that in my Weather Channel love and life, I tell you I get all those like older commercials. When I say older, I mean targeted to an older audience. I think one thing we do is pander to fear, right? That's how we market everything. So it's like, hey, if you've got diabetes, this supplement's been shown to whatever, and then they show these graphs that, like, if you don't know how to read data or you don't understand like clinical significance or p-values, etc., that as just the consumer, you're like, oh my gosh, I have diabetes. This will work for me, right? So there's this one. It's called berberine. Have you heard of that?
No.
Berberine, berberine. So it is supposed to be similar to a metformin,
Okay.
and people use it. It's like type 2 diabetic. Also, it can be used with people with high cholesterol. It can be for PCOS because, as you know, like we use metformin for PCOS patients, and that's polycystic ovarian syndrome for those that don't understand that acronym, and then or any metabolic syndromes. And you can just find this in the supplement aisle at your grocery store. People in the United States use this as an alternative to metformin because it doesn't require a prescription and it's seen as like more holistic. It and has been shown in some cases to like effectively control glucose. Some of the benefits of it have shown that there's a decrease in the A1C and there reduces your LDL and there is some mild weight loss in some of those studies, but It can cause a lot of GI upset. It has interaction with blood thinners. And some of these patients that they're finding are still taking their diabetic regimen because they're either not telling their providers or they assume, hey, this is like adjunct treatment. So they may not be taking metformin, but they're taking their insulin, maybe they're doing insulin and metformin. Maybe they're, doing Januvia or, some other medications. And there's been really profound hypoglycemia or very low blood sugars that have resulted from that. So, it is in some respects, from what I could find about it, just comparable to metformin, just in some small, really randomized control trials, very small ones. It's well tolerated, it's plant-based, but it's not FDA regulated, as you mentioned. And there is some inconsistency with dosing. They're having a hard time trying to regulate like what dose would equal what. So, and again, one of the risk would be that there's just not enough study. So if you are taking something like a berberine or something like that for your blood sugar and it's working for you, fantastic. Make sure that your endocrinologist or your primary care doctor, whomever is managing that for you, is aware that you're taking it and what you're taking it for, just so that you don't have some adverse outcomes. Providers, if you hear about a berberine, understand its use and understand that it's probably not a good concomitant med to be taking with other anti-diabetic medications. So that's what I learned about one.
Interesting.
What are your thoughts on that? Anything stand out to you with that?
No, not really. I mean, I think it's just I think it's good to point out, like, because like we said, if you're not reporting your over-the-counter medications and your blood sugar's
Yeah.
dropping, that's really dangerous. So you got to make sure that you tell your provider so they can adjust your other medicines.
I was just thinking, like, if there was like some commercial that was like, hey, you never have to go for your speaking of like well check, and we were talking to me here, your well check visit, you never have to do a yearly visit. You just take this pill and it like everything will auto regulate. If I wasn't in, I'd be like, sign me up. I'm taking two. Um, Consumers are just they're such a vulnerable market when it comes to
Yeah.
health. So got to be careful. Got to be careful.
Yeah. Well, there's also the desire for a quick fix, not even just in medicine, but in life, right? Like,
Hmm.
so, that gets dangled in front of you. It's tempting, right? So,
And hey, if berberine works better for you than metformin, come off the metformin. You know what I mean? Like
yeah.
I'm not suggesting that. I'm saying if the herb works, let your provider know it works.
Yeah, for
You know?
sure. Yep.
All right, you
Very
got one?
true. I've got one. So this is a one that I think has been very popular over the years and in terms of being talked about. So St. John's wort is one. So that's a
Oh, if you don't know St. John's wort, you're not in medicine.
yeah,
Because I think that is like that's the one herb we use for every example.
yes. Yes. So it's been utilized over the years for like things like wound healing, insomnia, various kidney lung diseases, but today it's really mostly used for mild to moderate depression.
Hmm.
And so there's limited data on it in terms of like effectiveness for those with severe depression or suicidal thoughts, but there's more data around it for the mild to moderate depression symptoms. But as we mentioned, it also really can interfere with numerous medications. So including if you're on any prescribed antidepressants, birth control, blood thinners, certain pain
Mm.
medications, some types of cancer treatments. So, again, not something that you should take without talking to your healthcare provider about it and really looking at the other medications that you're taking, because some of those interactions with the drugs can actually be fatal. If you take it, it can be severe reactions. There's also some side effects that can cause some dizziness, confusion, dry mouth, increased light sensitivity, those type of things. But it has been shown to be effective, but again, you just need to be careful with what else you're taking.
Interesting. St. John's wort, I think where I heard it the most was with anticoagulation when I was on the speaker bureau for Xarelto. That was like one thing that they always drove home with us when we were, either we were talking to clinicians in practice or, doing just lectures in general. But St. John's wort, I think we hear that like with Eliquis or Xarelto or, Coumadin, its effect with blood thinners. And I think it was because it happened, right? Like people were taking it, we weren't paying attention. I say we, not you and I, but generally in medicine at the time weren't really paying attention to that interaction. I think there were some, poor outcomes, which
Yeah,
led to some more study there. I swear my mother took St. John wort. I can remember seeing that in her cabinet growing up as kids.
maybe.
You don't remember that? Did your mom ever take that?
I don't remember seeing it around my house, but
There's also one for menopause. I'm sure you probably, one of us have it on a list somewhere. I don't for today, but another one that had some interactions. But one of the ones I wanted to talk about was elderberry. Have you heard people talk? I feel like it ebbs and flows. I heard it maybe in the early, like 2010, 2011, kind of went away. And that was like when we had the swine flu, that endemic with of swine flu, and then COVID, it came back, and I started seeing elderberry, especially because everybody was home and we were all like hydroxychloroquine, bleach, elderberry, like whatever, whatever solutions people were trying to come up with. But elderberry came into mind, and that was actually one I studied because they were making like over the counter elderberry syrups and stuff for children. And I wondered, oh, like, tell me a little bit more about elderberry. But a little fun fact though, elderberry was used during the 1995 flu epidemic in Panama. And they were actually using elderberry juice to treat flu symptoms because they had a shortage of medications, which I thought was pretty interesting. But overall, elderberry is used for cold and flu. Sometimes it's prevention. So they'll label it as flu prevention or flu treatment, immune support, or any like inflammation. That's very non-specific because the body can be inflamed internally a lot of different places. But people use it because it's marketed in a natural way to like shorten colds and flus, especially during the winter months when we see more of that. But it's widely available in the syrup, like I told you. You can also get it in gummies, and you can get it in teas, and you can get it in capsules. And elderberry is a plant, so it's rich in flavonoids, which inhibits, they believe, inhibits viral replication and modulates like a cytokine production. And then some lab studies suggest that like elderberry can block the influenza virus, though the studies that I had reviewed, the p-value was not very strong there. So I'll just leave it there. Some studies show that elderberry may shorten the duration of colds. They also shows that it could reduce the symptoms. But overall, I think they lean more into that antioxidant and anti-inflammatory property of it. But it does have some reactions. So if you have the flu and you've got some significant lung involvement, and or you've got COVID with significant lung involvement, sometimes we get put on steroids, right? So if you're taking elderberry with steroids, it can stimulate the immune system and actually counteract the drug. It will block the effect of the steroid. Also, it can worsen immune status with patients that are on autoimmune medications. And that's one thing that I did turn that box with the kids and look at it. And it gave warnings about a couple things, but that was one that I thought was a little tricky. Now, this is one brand that was marketing it, but it was tricky to me because if you see something that's promoted for immunity and you have an autoimmune condition, I think it can be tricky where you go, oh, this will help my immune system. You know what I mean?
yeah.
And then you end up taking it, but it actually like it backfires. So we also have to remember that elderberry is a plant, and it's kind of raw berry and bark type of a plant, but it's a toxic plant. So it can cause nausea, it can cause vomiting, diarrhea. It's got like cyanogenic glycosides in it. So if it's not compounded appropriately, it's a deadly plant. So you just got to be careful there. Lots of debates on it, but ultimately, again, this is one of those things where you talk to your provider, do your homework, and your provider should do theirs. And if it works, great. But just be mindful of the conditions that you're treating, and make sure that we're not adding any other medications to that could make it worse.
Yeah.
And a tip could be just look for a standardized elderberry extract. There's one called Sambucol, Sambucol, and that's one of the only ones that has been lab tested and is preservative free. So any raw or homemade versions, which happens, they were selling these in jars during COVID. I'll never forget this. Like somebody was home pressing elderberry, making them in jars, putting them out on their porch. They were ordering through social media, and people were going and picking up these jars of elderberry and giving them to their kids. That's the ones where they say be careful because you're not measuring how much elderberry you're using. And again, toxic plant. So you
Yeah.
you really need to look for more regulated sources there.
Yeah. No, that's a good point. And I think, the toxicity is more in that raw form, right? Rather than if it's kind of processed and cooked and things like that. So,
Right.
okay. All right. Well, one that I had on my list is Ginkgo bilboa.
Ginkgo biloba.
Yeah, biloba.
That's an old people commercial too. I see
Yeah.
that one a lot.
Yeah. So this is native to China. Was traditionally used back in Chinese medicine for thousands of years. And more traditionally now it's used for things like heart disease, dementia, mental difficulties, sexual dysfunction. Although it really hasn't, the studies haven't been there to prove really if it's effective for any of these conditions, but it is used. But interestingly enough, this is another one that can be mildly toxic, the seeds of it. So people can eat the raw fruit, and then there's the toasted seeds, but those seeds are actually the toxic part of this one, and
Mm,
should only be eaten in small amounts, if at all. Um, and then this is another one that can interact with a lot of medications. So it can interact with our blood thinners, so anticoagulants, antiplatelets. So if people who've had blood clots or heart disease are on those medications, need to think about that. It can also reduce the effectiveness of certain antidepressants. So if you're on antidepressants and you're noticing that you're taking the ginkgo and then your depression is getting worse, it could be because there's an
yeah.
interaction with your medication.
That's a tough
Um,
one though, April. Don't you think?
it
Like,
is.
having we've talked about this on the podcast, but having talked to had postpartum depression, um, that's such a tough space because when you have depression, and then somebody says, "Hey, I'm gonna give you this medication. Let me know if it gets worse." You really kind of disassociate. Having happened to me personally, I didn't know I was getting worse. So that's just one area that I'm always like, it's not just always up to you as the patient to know.
Yeah,
It's
that's
probably
true.
this is why you want to tell your providers and why you want to tell your family or things like that, so they can begin to notice changes too. Just sorry, senseless plug, but
No, I mean,
um,
it's a good one. I mean, it's true.
yeah,
I mean, you might not personally have the insight to kind of see that, right? Like because you're not watching yourself from outside, right? It's you. So it's hard to sometimes see what's going on with yourself. Um, and then some other potential interactions are with seizure medications, some cholesterol medications, diabetes, HIV medicines, omeprazole, which is what we use for kind of reflux, GERD. So all of these can potentially have interactions, and actually domperidone as well, which can actually cause some changes in your EKGs, in your heart rhythms. So all things to consider if you're taking that. So again, just another driving home the point that, if you're taking this, you need to make sure your provider knows and they can look at your list of medications and make sure it's not interacting with anything.
yeah, yeah, good info. Hmm. Okay, I'm gonna ask a question.
Sure.
Would you take a medicine if you knew it was going to turn you blue, but it would prevent viruses?
No.
Well, some people do. Now, I'm very interested in this one for a couple reasons. One, do you remember when we were kids? Did your parents watch Oprah?
No.
Okay. Oprah was on, gosh, I don't remember what time. Somebody's going to correct me here, but I think it was like 4 o'clock. There was like Phil Donahue, Oprah. My mom like had these starting at noon with like her soaps all the way through the afternoon. I could pretty much tell you like what was going to be on TV. But Oprah had this guy on, and his name was like I think Paul Carrison, Crossan, something like that. But he was famously blue for ingesting colloidal silver, and it had turned like his whole skin blue. And I remembered that as a kid. But what sparked my interest was there was a recent documentary called Mother God, and it was a woman that was trying to sell this colloidal silver for immune support, and claiming that it like took care of infections and sinusitis, and we do use it sometimes for wound healing. I have seen it in that space, but never like for ingestion. But people use it because it's promoted as a cure-all for bacterial or viral or fungal infections, especially in the natural, like by natural health enthusiasts that are, these are people in this space that, from what I'm researching, and again, anybody out there correct me if I'm wrong, but these are in, like more of the extreme spaces where they're like absolutely anti-Western medicine, right? That they're going to use just stuff from the earth. So they are, it can be marketed as a liquid, it can be a nasal spray, or it can be topically. Topically, I'm familiar with. The other two, I'm not. But within it, there's these silver ions, and they bind to proteins, allegedly, in bacterial cell membranes, and then they cause death to the cell. And that does happen in wounds, but again, not studied internally. Some of the benefits topically, they do help for wound healing, and some users do report like improvement with sinus relief if they do it as a spray. But there's no credible evidence that any oral or inhaled colloidal silver treats truly any condition. And in fact, the FDA did declare colloidal silver as not safe, like all caps, not safe or effective for any disease. And they usually don't come out that hard, right? They will normally come out and go, um, it's not studied, or it's what, but this one, they're like, absolutely not. Like, please don't do it. It can bind to certain medications. It can decrease their effectiveness, specifically things like levothyroxine, any of your thyroid medications. And the heavy metals of the silver accumulate within the body. So that's when that permanent bluish gray discoloration of the skin forms. And you can't get rid of it when that happens. It also causes kidney damage, neurological issues, and GI distress. It does interfere with absorption of antibiotics, but I don't think people that are taking this at least regularly are taking antibiotics. Are probably using this instead. And there is no regulatory body that I could find across the world that endorses this use for internal use. So this is just one that I might put my foot down a little bit more. Like, please, please, please don't.
Yeah.
Until the data comes out, even if your doctor says yes, read. There are some integrative practitioners that argue that topical or nasal use in chronic sinus infections, that this is successful in those for that in wound care. Again, within the same integrative community, I've yet to find anyone that goes, but yeah, let's like just drink it like crazy. But it is available. And in that documentary, it actually ends very tragically. She passes away. She's like 40 years old,
Oh,
turns blue.
jeez.
Just like this guy that I saw on Oprah, she turns blue. But she's pandering this to her community that she's like, again, like naturopath. And there's a lot of other stuff that's occurring during this. But for purposes of just the silver, it's, she's got all these people that are like hawking it and they're selling it. And all these people around the world are buying it and taking it. So she passes away. And she's severe alcoholic as well. So it's hard to tell what went where first. But if you're getting multi-system organ failure from this heavy metal accumulation, it's probably not a great thing. So, for me, my takeaway from this April was just more like, let's like stick to the silvers in the wound. We know those work. If you're anybody that's doing wound changing at, LTACs or anybody in wound care, that we use silver in that setting. It's a great topical agent, but let's avoid drinking or inhaling it. And that's for everybody listening. That when in doubt, like, we don't want you to turn Smurf blue, for any of it. Anything that turns you blue is probably telling you it's accumulating somewhere, but this is not a vitamin, guys. This is like this one is not a supplement. This one's a heavy metal. And for that, like, really, really, really do your research. And if you've got a provider that is pushing you, I don't know, April, what you'd say here. My advice would, a provider that's saying this is safe, I would ask what studies they're looking at. That's,
Yeah.
Yeah,
no, I think that's fair. Fair to ask that.
Yeah.
And see what look at the studies and look at the evidence to see the basis behind the recommendation. I think that's always a fair question.
Well, just figure, if your liver fails, you build up bile, and you get jaundice or you turn yellow. That turning a color is never a great sign. Pancreatitis, orange. So you're turning blue. Just for me, and I'm not even poking fun of it. I'm being very serious. You're accumulating something that you're not
Right.
supposed to be. So
Yeah.
it's not worth not getting a cold or the flu, to accumulate the silver, obviously, but to accumulate and turn a whole different color. And actually, I should send you a picture of that guy. It's fascinating. It's fascinating.
Yeah, I'll have
It's
to look
blue.
at.
It's really blue.
Huh. Interesting.
Yeah.
All right. Well, should we do one more to wrap it up?
Yeah. Let's do
All
one more.
right. So This one, I actually am going to combine two together because I have been
Cheater.
um,
Just kidding. It's not,
hearing
this one's not a race, so I'll let you do
hearing
two.
a little bit about both of these for actually newer reasons than historically they've been used for. So, um, two things: so turmeric and
Mm.
ginger.
Oh my
And
gosh, I
so
use these all the time. Tell me. Uh-oh.
yeah, so it's not an uh-oh,
I don't use
but
them all the time. I use them to juice. Like I'll
oh,
add them to juicing.
to
You're gonna
juicing.
tell
Yeah,
me
yeah, yeah.
something bad here?
No,
Okay.
it's not bad. But so turmeric historically has been used to treat things like chronic inflammation, pain, metabolic syndrome, anxiety.
Hmm.
Ginger, I think the most common use of that is like, nausea
Benihana's
with
ginger
pregnancy.
sauce.
Yeah.
That's its common use.
Yeah. I mean, I remember like, when I was pregnant and throwing up, I would drink ginger ale, things like
Or
that. People
ginger
have ginger
chews.
tablets. Yeah, the chews.
That was our
Um
grandmother's, April. They'd be like, "Come drink a little bit of ginger ale." And you're like,
Well, and
or
even
warm
still now,
7
like
Up.
if I don't
I'm
feel
like, "You
good
trying
in
to
my
make me
stomach,
puke or what?"
I'll drink it.
Yeah.
But yeah, so it's used for like relief with nausea, with the pregnancy, chemotherapy, medical operations, things like that.
Hmm.
So um there's also potential some animal research that's suggesting that it may have some potential benefits for treating and preventing heart disease, cancer, things like that, but those are still kind of being studied. But the reason I thought it was interesting is that we now, I feel like my Facebook is always quick fixes to weight loss, especially hormonal weight loss and with females. And there's all these new kind of supplements and things coming out. And I've read a lot about how they think both turmeric and ginger can help because they can increase your metabolism.
Hmm.
And it's being used in a lot of these supplements that you see now where people are saying, oh,
Interesting.
take this supplement for postmenopausal or perimenopausal weight gain, and it will help you lose it. So I thought that was interesting.
Hmm.
But, just like anything else, these can interact with medications that you're taking. So they can, and actually, turmeric is a relative of ginger, so they have some similar properties. But so they can interact with medications, like again, blood thinners, those antiplatelet medications,
Hmm.
some pain medications like NSAIDs, things like that. So, um,
Really?
yeah. So just, again, I
Moderation?
know I feel like we sound like a broken record today, but everything in moderation and just being cautious of what
Well, I
you're
guess it's
taking.
different
So
if you're using it to cook with, versus in a
right. So
supplement.
that's a good point. So the amount that we would use to cook with is not the amount that you would be worried about. It's those if you're taking the supplements, you need to be cautious of how much you're taking and
Well,
be
I don't
aware
know
of how
about
much
you,
is
but
in them.
ginger, I could tell you side effects of ginger immediately. It's all GI. Not all, but for me, um, I love ginger, April, but it's Benihana's ginger. Like, they have a ginger salad dressing, and then they have like a ginger dressing, like that you dip your other stuff in, but almost to a point that it's like obsessive. Like, I obsessively eat it, but it's an immediate upset, like GI upset, if I have
Mm,
too much ginger. Turmeric, I've just seen turmeric a lot in like elixir, like juice elixirs. If you go to a juicery, or
yeah.
we've like I mentioned, we started juicing, but it's also included in a lot of Indian dishes, as just as a spice
Right.
and pretty
Yep.
regulated. So that's why I think when you said that, I was like, don't tell me that. Like, I'm just
Yeah.
finally cooking from
No,
scratch.
I think it, and like I said, I think it's fine to cook with it, like in small, those portions aren't big, right? But it's the
Yeah.
the supplements that you
Turmeric tastes
take.
terrible, by the way.
Oh, really?
I
I haven't
accidentally put
cooked
too
with it.
much. Yeah, once upon a time I put too much, and we were juicing, and it looked great, and then like the kids, we all took a drink, and we all like looked at each other and ran right to the sink, and she was like, "This tastes like metal." It did taste like metal. It was like metal in your
Oh,
mouth. We had the worst aftertaste, and the only thing we could chalk it up is we were just very we were not very judicious, I'll say, with no, we were judicious of our use of we just so much turmeric root. No
yeah.
good. Well, that's
All right.
interesting. I kind of like that you took it to something that was going to challenge me with food.
Yeah.
Thank you.
I'm
Thank you
full
for
of
making it
surprises.
spicy.
Yeah.
Yeah, I could tell. I also like again want to plug to everyone. This is no shame episode. This is just for your knowledge. And, the way April and I approached this was we didn't know about a lot of these things, but it's definitely going to change the way I look at things with patients too, or maybe not change, but be a reminder. Am I looking at every med as a provider? Am I being thorough? Especially some of these, our goal for this was to use the ones that are not as common, right?
Right.
That we may start seeing, or maybe they're becoming a little bit more mainstream now. As providers, we have to do our due diligence, make sure we're doing the right thing. And as patients, you have providers for a reason. Lean
Yeah.
into them and ask them those questions and do your own research, but just don't go off the hype.
Absolutely.
There are risks, you
Yep,
know?
for sure.
I like the episode, eh?
Yeah, it
Now
was
we'll have to
fun.
tell you on the next one, do we have ducklings? I don't know how long they take, 6 to 8 weeks, something like that. So
I
it
have
may
no
be a couple
idea.
episodes
I'm
from now.
surprised as you Google everything. You don't know exactly how long
It's
they.
6 to 8 weeks. I don't know when they were laid.
Oh, I see. I gotcha.
So somebody said, put a trail cam up. I was like, I'm not that committed. I'll put an air tag on a duck before I put a trail cam.
Well, on that note, thanks for listening, everyone. And as always, we would love to hear your feedback. If you have any suggestions on topics you want to hear about, please let us know. You can email us at oncallpodcast@soundphysicians.com. We're also on LinkedIn and Instagram with On Call with April and Alicia. And you can listen to us on any platform that you use to listen to your podcast on. So
That's right. That is absolutely right. Until the next time, you guys stay well, and we'll continue to look at ginger and turmeric. No, just kidding. You guys stay well, and we'll stay on call. You guys have a great, 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 great week.
bye, everyone.
Bye.